ફોન નહીં.
હા વાંધો નહીં ક્યાં લે
પટવા
મેમ ડાયરેક્ટ યુટ્યુબ પર આવશો.
ધમા માઇક ચાલુ કર દે પહેલા ત્યાં જ છે
सुना ठीक है
મસ્ત માહિન કેમિયો દે 10 रुपये में कमेंट करवाएगा. प्लीज $1 डोनेटेड.
कुछ कहना चाहेंगे आप?
तो सर तू अभी
आपका
लाइव आ गया. ठीक है
बहुत डिले हाँ मैम पहले एक छोकरा लिंक शेयर करी डायरेक्ट यूट्यूब पर आवशो तभी आई जशो.
સાહેબ ક્યાં રાખો છો? કેમ
બીજું બધું થોડું ખસેડી લે છે. ડ્રિંક વાળો ડબ્બો નીચે મૂકી દે છે.
आपको भी आना है? थोड़ा पीछे चले जाओ. सर का व्यू काउंट बड़ा हो यार. यहाँ क्यों देख रहे हो? फोन में देखो.
है ना हमारे जो से कोई नजीक वाला પાછળવાળાનું વાંધો ના દેખ આગળવાળા અહીંથી જોઈ લો પાછળવાળા ના આવી પાછળ તમે જુઓ તો ખબર પડે. એટલે આગળવાળા અહીંયા અવાજ ના રાખતા. આપણે ટ્રાય કરીએ ને નવું નવું ટેકનોલોજી સ્ટુડન્ટ જોડે 60% સ્ટુડન્ટ જોડે ટેકનોલોજી 60% ને હા પણ પેલું
પબ્લિસિટી
કેવું આવે તો આને હેરાન તારે નજીકથી લેવું.
થોડી વાર પછી આવશે નજીક લે.
બોલું એ તમને સંભળાયું ખરું?
ये मेरा कमेंट किसने मारा?
अरे यहाँ तो आएगी पर दूर दूर. हेलो 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 हेलो. हेलो. Today we will discuss about the mid-sagittal section. This is the head and neck mid-sagittal section. And this is the front side and this is the back side of the head and neck. This is the left side of the mid-sagittal section, left side of the head and neck. First of all, we will discuss about the structure which are seen inside the mid-sagittal section. This is the muscles of the tongue. Here you can see there are 4 muscles inside the tongue. Genioglossus, geniohyoid, styloglossus, palatoglossus, and styloglossus. So these are the muscles of the tongue. This is the hard palate. Just behind to the hard palate, you can see there is a soft palate. Soft palate, there are 5 muscles. Tensor valley palatini, levator valley palatini, palatoglossus, palatopharyngeus, and musculovium. These are the 5 muscles of the soft palate. And soft palate mainly the function is during the deglutitions. The soft palate which is elevated and it separates the nasopharynx from the oropharynx. So during deglutitions it elevates, and it is all these 5 muscles which is innervated by the pharyngeal plexus by vagoaccessory complex. Here you can see this is the lateral wall of nose, and lateral wall of nose which is formed by the there are 3 parts of the lateral wall of nose. The anterior part it is called the vestibules, middle part it is called the atrium, and the posterior part it is called the concha. પેલી બાજુ વાળો સેક્શન લઈ લો, પેલી સાઈડ વાળો આ બાજુ લેવડાઈ લો. So, lateral wall of nose, which is basically from 3 parts. The most anterior part it is called the vestibules. This is the vestibules, and we already remove the nasal septums. And after removing the nasal septum, you can see on the lateral wall of the nose, both the sides, we have already removed the nasal septums. So this lateral wall of the nose, which is mainly formed by the 3 parts, most anterior part is called the vestibules, and between the vestibules and atrium, this mucocutaneous fold, it is called the limen nasi, and this is the atrium. And atrium and concha, in between there is a mucocutaneous fold, it is called the agar nasi. This is the superior concha, middle concha, and inferior concha. Middle concha and superior concha are the part of the ethmoid bone. Just above to the superior concha, there is an opening of the sphenoidal sinus, it is called the sphenoethmoidal recess. Here you can see there is we will insert the forceps and it is open just above to the superior concha, it is called the sphenoethmoidal recess, and below to the superior concha there is opening of the posterior ethmoidal air sinus, but it is difficult to hear. This is the middle concha. Once we can reflect this middle concha, you can see there is a hiatus semilunaris. This is the hiatus semilunaris, and just below, above to the hiatus semilunaris, there is one elevated area. It is considered as a bulla ethmoidalis, and inside the bulla ethmoidalis, there is an opening of the middle ethmoidal air sinus. Hiatus semilunaris, there is an opening of the 3 sinuses. Most anteriorly, this is the frontal air sinus. So the most anteriorly, the frontal air sinus which is open inside the hiatus semilunaris. Into the middle part there is an opening of the anti-ethmoidal air sinus, and posteriorly there is an opening of the maxillary air sinus. So inside the hiatus semilunaris there are 3 openings. One is the most anteriorly frontal air sinus, middle there is anti-ethmoidal air sinus, and posteriorly there is a maxillary air sinus. And just above to it, hiatus semilunaris, there is a elevated area, it is called the bulla ethmoidalis, and there is a opening of the middle equimedullary sinus. This is the inferior concha, it is the separate bone, and just beneath to the inferior concha there is a opening of the nasolacrimal duct. So this is the above the nose, this is the roof of the nose, and roof of the nose which is above, which is formed by the libriform plate. Anteriorly it is formed by the nasal bones, posteriorly it is formed by the sphenoidal bones. Floor of the nose which is formed by the hard palate, and hard palate which is formed by the two things. Palatine process of maxilla which forms the anterior third part, posterior third part which is formed by the horizontal plate of the palatine bones. And most posteriorly you can see there is a soft palate. Behind to the soft palate there is a opening of the internal acoustic meatus. After that, behind to the concha you can see there is a portion, it is called the above to the soft palate, and below to the sphenoid bone there is a area, it is the nasopharynx. It is called the nasopharynx. Nasopharynx. Between the soft palate to the upper border of the epiglottis, the common passage for the air as well as food, it is called the oropharynx, and just behind to the epiglottis, the part of the pharynx till up to the lower border of the cricoid cartilage. Here you can see this is a cricoid cartilage, and after that it becomes continuous as a trachea. So lower border of the cricoid cartilage, behind to it there is a area behind to the larynx, it is called the laryngopharynx. So the pharynx basically three parts. The most upper part it is the nasopharynx, middle part it is the oropharynx, and the lower part it is called the laryngopharynx. The pharynx have a extrinsic and the muscles. There are three constrictor muscles, superior, middle and inferior, as well as stylopharyngeus muscles. The stylopharyngeus which is supplied by the glossopharyngeal nerve. As well as we can see here, this is the fold of the brain, it is called the temporium cerebelli, between the occipital lobe of the cerebrum and cerebellum. Middle part here you can see this is the fox cerebri. The fox cerebri, which is the upper part, it contains the superior sagittal sinus. Lower part it contains the inferior sagittal sinus. On the posteriorly it contains a straight sinus. And just below here you can see there is a fox cerebelli between the two cerebellar hemisphere. So these are the parts you have to identify during the exam. This is the two cerebral hemisphere which is connected by the corpus callosum, and here you can see there is one artery which is goes in front of the, it is the anterior cerebral artery. This is the anterior cerebral artery. This is the hypophyseal fossa which contains the pituitary glands. This one is the pons, this one is the medulla, this one is the midbrain, and here this is the thalamus, and this is the hypothalamus. So these are the structure you can see in the midsagittal section.
કઈ કહેવાનું मैं कमेंट नहीं कर रहा था, ठीक है।